Welcome! In today's video, we'll be overviewing the consistency imperative, how healthcare leaders retain staff. Healthcare is built on relationships. Patients do not experience healthcare as a series of transactions. They experience it through people. The nurse who remembers their story, the receptionist who helps them navigate care, and the staff member who creates trust all influence the patient experience. This presentation explores a simple idea. Continuity is not just about keeping physicians in place. It is about retaining the entire ecosystem of healthcare workers because every role contributes to safety, quality, and trust. When we talk about continuity in healthcare, many people immediately think about the physician relationship. But modern healthcare is much more complex. A patient interacts with schedulers, medical assistants, nurses, specialists, technicians, and administrative teams. Each interaction either strengthens or weakens the patient experience. Continuity is created when the entire healthcare team remains connected and understands the patient journey. Healthcare continuity has multiple dimensions. The first is interpersonal continuity, the relationship between people. The second is longitudinal continuity, maintaining consistency over time. The third is management continuity, ensuring different teams coordinate care. And the fourth is informational continuity, making sure knowledge follows the patient. When one of these breaks down, the patient feels the consequences. Humanity is rapidly adopting artificial intelligence, automation, and digital tools. These technologies can improve efficiency, but they can't replace human connection. A system can analyze information, but it can't replace empathy, trust, emotional intelligence, and the ability to understand a patient's personal situation. The future of healthcare is not humans versus technology, it is humans using technology effectively. Staff stability is not just an HR metric. It is a patient safety issue. When experienced employees stay, organizations maintain institutional knowledge, stronger communication, and better teamwork. High turnover creates repeated learning cycles, increases the chance of mistakes, and disrupts the consistency patients depend on. Continuity also has a financial impact. Turnover is expensive because organizations lose productivity, spend more on recruitment, and constantly train replacements. Retention creates capacity. Experienced employees work more efficiently, reduce avoidable errors, and help organizations operate more sustainably. Patients' experience and employee experience are connected. When employees feel supported, they are more engaged. When employees are engaged, patients receive better communication and care. This creates a positive cycle where better working environments create better healthcare experiences. Turnover does not happen in isolation. One employee leaving impacts workload, communication, morale, and remaining staff. Over time, this creates a domino effect where burnout increases and even more employees consider leaving. Retention is not just about keeping people, it is about preventing system instability. The paradox is that healthcare organizations often focus heavily on increasing productivity while overlooking the foundation that supports productivity, people. A healthier workforce creates healthier patients and stronger operational performance. Continuity is not slowing healthcare down, it is what allows healthcare systems to function effectively. One of the biggest leadership shifts is moving from transactional relationships to relational relationships. A transactional approach views employees as resources filling schedules. A relational approach recognizes employees as individuals with goals, experiences, and motivations. People are more likely to stay when they feel valued beyond their job description. The psychological contract represents the unwritten expectations between employees and organizations. The 4 A's are awareness, acknowledgement, action, and accountability. Employees want leaders who recognize challenges, listen to concerns, take meaningful steps, and follow through. Trust is built through consistent actions. Psychological safety means employees feel comfortable speaking up without fear. In healthcare, this is critical because silence can create safety risks. Teams perform better when people can identify problems, ask questions, and challenge decisions respectfully. Employees are not all motivated by the same things. Some want career advancement, others prioritize stability, others want opportunities to explore new roles. Effective healthcare leaders understand individual employee journeys instead of using a one-size-fits-all retention strategy. Retention cannot rely only on culture. Work design matters. Healthcare workers experience significant workload pressure. Organizations need strategies like technology support, reducing unnecessary administrative burden, flexible models, and mental health resources. The goal is not just surviving healthcare work. It is creating sustainable careers. Recognition matters, but meaningful recognition is more than rewards. Employees want to know their contribution has value. Simple actions, appreciation, feedback, listening, and acknowledgement can have a significant impact on engagement and retention. Retention cannot be owned by HR alone. HR creates systems, but leaders create experiences. When leadership and HR align around employee development, communication, and trust, organizations create stronger cultures where people want to stay. The modern retention model is built on 4 connected areas. Purpose, understanding why the work matters. Psychological safety, feeling respected and heard. Respect, being valued as a professional. Autonomy, having ownership and growth opportunities. When these exist together, retention becomes a natural outcome. The main message is simple. People do not leave organizations only because of jobs. They leave environments. Healthcare continuity depends on the people delivering care every day. By investing in relationships, leadership, psychological safety, and sustainable work environments, healthcare organizations improve both employee retention and patient outcomes. The future of healthcare depends on creating systems where people want to stay.